Hello everyone. In this video lecture, I will be discussing to you the continuation on understanding phlebotomy. So the following are the objectives for this discussion. So we will be identifying the different regulatory agencies in the laboratory, what are their functions, what are their purposes in the hospitals as well as in the laboratories. And then since the core of this subject is about blood extraction. So we need to review over and over again what are the qualities, ideal qualities of a phlebotomist, as well as what must be our attitude during patient interaction. And then we'll be naming as well the different types of patient consent and the different legal issues that we might face during blood extraction. Okay, so regulatory agencies class, basically, these are the organizations that are inspecting laboratories and medical offices for the purpose of ensuring the quality assurance program of the hospital and the laboratories. So, before, during my, ito nag-work pa ko sa laboratory, so we used to perform quality control every day. We are going to perform cleansing sa machine. Of course, it processed more than 1,000 samples in a day. So we need to ensure that our machine is working well and is ready for every shift. But this quality control class, this will depend on the protocol of the laboratory. So there are laboratories that they are performing quality control every shift. And there are other laboratories class that they are performing quality control once a day. So I'll just give you an overview of how quality control works. Okay, so we have this three levels of controls, blood sample with high value, with normal, and with low value. So this controls class, na siya pre-value on its product insert. And then we will be using that controls, we will use it as a sample. Then we will run sa machine. Then after nag-read na si machine, we are going to compare the result released by the machine with the product insert. So if nag-match, the same sila og result na na-release, it means that the machine is releasing accurate results. Okay, so in 1988, we have here the Clinical Laboratory Improvement Amendments, or the CLIA 88. So actually, class, this is already a revision of CLIA 67. And these amendments were established in order to ensure that all of the laboratories that receives funds from the government, regardless of how small it is, how big, or kung sa ba ang size sa laboratory, kung asa ba siya located, sa rural ba na areas or in the city. So as long as nag-meet siya og standards, and these standards are written on these amendments. Okay? And the main regulatory board class that is responsible in checking the laboratories if they are following these amendments is the Centers of Medicare and Medicaid Services. Other than that, they are also establishing qualifications for phlebotomists. Okay, so we have here, class, the different categories of the laboratory test in that we are performing in the lab. So we have three categories. This is according to its complexity. So we have waved, we have moderately complex, and we have the highly complex. Sorry. So for the wave class, this type of tests are not subject to inspection or checking. It's because very simple lang ang mga tests, very minimal ang risk on the part of the medtech. So for example, Ani, if nakita na ninyo ang urine dipstick, so we're going to use that strip, i-dip siya sa urine, and then there will be color changing depending on the factors that is present on the urine. So very simple lang siya. No need to put it into writing. No need to undergo inspection. While our moderately complex and highly complex, so this laboratory test undergoes inspections, and of course, si higher complex or highly complex, mas strict ang iyahang inspection because it requires no complicated na mga procedures and steps. Okay. So, not only laboratories, but also the hospitals, as well as the office of the physicians, they must undergo as well regulations, of course, in order for it to provide quality patient care. So we have here two examples of the agencies that are responsible to accredit health facilities. So the first one class is we have the Joint Commission. So the Joint Commission is the main accrediting body for healthcare facilities in order to ensure that they are giving high quality standards of patient care. While our College of American Pathologists, so this is focused on medical laboratories. They are the ones who are accrediting laboratories as well as reference laboratories. Okay. So, ma'am, unsa man di ay ng reference laboratories? So, okay, I'll give you an example. For our laboratories here, just like the laboratory that we have sa San Pedro Hospital, that is not considered as a reference laboratory. It's because when we say reference laboratories class, this is for specialized tests. This is for confirmatory testing. So, example, our HIV. So, the laboratories that we have here in Davao City, yes, we can perform HIV, but only screening. So, when you say screening test class, it can only produce positive or negative result. So, once the patient turned out to be HIV positive, that is the time where we are going to submit the sample to a reference laboratory for confirmatory testing. When we say confirmatory testing class, the reference laboratory will going to quantify unsa na ba kadaghan ang HIV or ang virus sa sample or sa blood ni pasyente. So, that is termed as quantitative. Okay, so we are going to identify the quantity or the viral load para mahibalaan sa physician if is it AIDS already or at the very beginning pa lang sa HIV infection. Because class, when we say AIDS, that is already considered as a full-blown na type of HIV. So, that is the difference. But the problem, class, in our country, reference laboratories can only be found sa Luzon. Okay, we don't have reference laboratories here in Mindanao as well as in Visayas. So hopefully, it was mentioned man before by the government no, that they will put up reference laboratories both in Visayas and Mindanao para dili na ta maglisod og send sa ato ang sample to Luzon area. Okay, the next agency is we have Clinical and Laboratory Standards Institute or the CLSI. The former name of CLSI class, it's National Committee for Clinical Laboratory Standards. So it is, kindly check na lang sa inyong mga book na siya dito, kindly read the reference book given. So, this organization or agency, they are the ones who are developing procedures and policies in the hospital. So when we say procedures and policies class, these are the documents per section in the laboratory. Naka-outline na diha class how specimen must be collected, how laboratory tests are performed. So example, in the future, pag na-intern na mo, no, so the first thing that you are going to do is to check the procedures and policies of the laboratory. So if you will be assigned in clinical chemistry na department, so naagid na siya sa ilahang area, kini naka-folder unsa ba na siya ang presentation sa laboratory. So open the policies and procedures for you to be guided on how to perform the different tests in that specific section. And they are the ones as well who created this three phases: pre-examination, examination, and post-examination. So this was already discussed no in the previous topic. So before, the term that they used is pre-analytical, analytical, and post-analytical. But after 2010 class, they changed it to pre-examination in order for it to be uniform, no, with the documentation that we are sending to the ISO or the International Organization for Standardization. So para dili na siya mag-confuse, then the same na lang siya og terminology ang ilahang gigamit. Okay, so pasensya na ha if na ay mga background noise. Kay murag kusog-kusog yun ang ulan. So I hope every one of you are safe this day. Okay, so let's continue. More of the regulatory agencies, we have the Centers for Disease Control and Prevention. So they are the ones, class, who oversee the various aspects of procedures performed by the phlebotomist. Okay, so they are the ones as well who implements public health regulation. So very sikat ni sila na agency no tong during COVID-19 because they implement mga different preventive measures such as wearing your mask, wearing your wearing your gloves, hand washing, so in order to contain the infection. Other than that function, they are developing, they are responsible for categorizing mga bag-o na mga tests. Since very advanced naman ta, we have our DNA testing, we have the PCR testing. So they are the ones who are categorizing this newly developed laboratory test as waived, moderately complex, or high complex. The next one is we have our occupational safety and health administration. So in our profession class, it's very common to have accidents, no, that we might experience during the practice of even blood extraction. So ang pinaka-common class na accident is needle prick. So example, nagkuha ka og dugo sa mga HIV positive na patient. Then after that, you accidentally prick yourself from that needle. So always good, inform the chief medtech right away. Or if you are still an intern, inform your CI right away for you to be given immediate medication. So that is the responsibility of the hospital or the laboratory class to give these medications that you need in if ever na kay mga accidents na na-encounter during your shift or duty hours. So, free na siya ang testing na naihatag na mga vaccine sa imuha ang hospital. So, if ever walay ana na programs ang hospital, pwede sila kasuhan because they must ensure, class, that their workers are safe in times of accidents. Other than that, OSHA, sila po na ang nag-mandate sa mga different PPEs that we should wear inside the laboratories, that we are required to wear our lab gowns during our duty hours, our mask, and our gloves. So that is a form of prevention as well. In order for us to minimize further exposure to different microorganisms that might be present on the samples. Okay, the next one is our Environmental Protection Agency or the EPA. So they are the ones, class, who are ensuring that the proper disposal of medical waste are being followed. And other than that, class, they are checking as well if the laboratories or the hospitals follow the different protocols set by MWTA, by the DOT, and the NRC. So let's describe the function of each of this agency. So we have the Medical Waste Tracking Act. So they are the ones who are kanang naadiha kung unsaon ang pag-dispose sa mga different infectious waste that we have in the laboratory. Another one is the DOT. So when we are going to transport our sample, just like katong example na ko earlier, if we are going to transport our sample from Davao City to a reference laboratory in Manila, so we need to follow a requirement from the Department of Transportation on how to package properly this sample. in order for it to maintain its integrity, para i-handle siya with care, no, during the transportation. So actually, naana siya training, gina-undergo ang medtech no on how to properly pack this type of sample. Unsa ba ang makita on the outer side? Unsa ba na symbol ang dapat i-print nimo on the outside as the indication that this package is highly hazardous. Other than the samples plus, also the chemicals and the reagents that we are using in the laboratories, it should follow the regulations set by the Department of Transportation. The next one is the NRC. So they are the ones who are regulating handling and disposal of radioactive materials. So what are the radioactive materials that we have in the laboratory? So it's our irradiated na blood. When we say irradiated blood class, that is a process wherein we are going to deactivate the WBC that is present on our blood bags for transfusion. Ma'am, why do we need to deactivate the WBC, ma'am? The reason for that class is we have these patients who are highly sensitive or allergic um, to the presence of WBC. So we need to deactivate in order to avoid allergic reaction during blood transfusion. So that is usually the case for our patients class that are kanang mga cancer patients nato. So once wala na deactivate si WBC, then ongoing ang transfusion, so they will have this allergic reaction. Pwede siya makalead sa death sa patient. So in order to ensure na safe si patient during blood transfusion, i-undergo na to og irradiation process ang blood bag. Okay, so the next one is the Food and Drug Administration. So si FDA naman class, so ang main na product that we have in the laboratory which is regulated by the FDA is the blood bags that we use for transfusion. 'Di ba? I know some of you naka-experience na on how to buy blood bags sa mga patients. So it's the price for each of the blood bags is the same. Mapanaamang ka sa Mindanao, Visayas, or sa Luzon, so the same lang na siya. For example, the whole blood. So whole blood, that is 1,500. So bisag asa pa ka maabot sa Pilipinas, the same lang gihapon ang amount. So it needs to be regulated para dili siya mahimong negosyo no for some of the medtechs or some of the laboratories. Okay? Para the same lang siya ang iyahang price. Other than that, the content labeling as well. So I know nakakita na mo unsa ba ang mga label on the blood bag. So it was indicated there what is the blood type of the patient, is it A positive, B positive, kanus ang na-extract ang blood, kanus ang expiration date sa blood, what are the tests na na-undergo sa blood? Syphilis negative ba siya, HIV negative, or hepatitis negative? Asa ang source na hospital? Kinsa ang nag-process na hospital? So all of those information can be seen on the blood bags. So FDA in partnership with our blood banks, since these blood bags man are placed on the section na blood banking in our laboratory. So in the Philippines class, the organization responsible for that is the PBCC or Philippine Blood Coordinating Council. So they are the ones who are regulating, daghan silang mga standards no for blood banks. So of course, that is in line with the standards or international standards set by the AABB or American Association of Blood Banks. Okay, so those are the different regulatory agencies that we have in the that is responsible in checking the standards or if the laboratories are following these standards. Okay, so now let's proceed with the different qualities of a phlebotomist. Okay, so first and foremost, of course, a phlebotomist must be professional and must display professionalism at all times. So you must have this sincere interest in providing healthcare. That is why working in the Philippines class, it's very important to have this passion in your chosen profession. It's because we all know what is the condition of the Philippine healthcare system, no? So you need to have this eagerness to help other people. Dapat dili lang ka after sa imuhang salary. So that is why grabe jud ko ka believe sa mga medtechs who are nag-retire gid sila as medtechs or working in the laboratory. So you can see that they really have this passion in helping other people. So you need to have the standard of excellence, training, accountability, and pride in your work. And of course, you must be well groomed and have a professional appearance. So we will be covering that one later on. And being certified or licensed sends an important message to the patient. So pansinan na ninyo class pag musulod mo og laboratories na siya wall dedicated in which nakahang ang mga certificates sa medtech, sa ilahang license. So you can see, so that the patient will feel confident. Ay, makaingon si pasyente na, ay, ang mga medtechs man diri mga license, naka-undergo the og training. So try to check that one if you're going to visit a laboratory in the future. Okay, so the following are the attitudes of a professional. Number one is integrity, or the other term for this one is honesty. You are honest in what you are doing. Bahala na makasabaan ka as long as you display this honesty. For example, ang imuhang label kay patient A, nahimo kay patient B, nakambyo ang label. And then it turned out patient A is HIV positive and you release that result for patient B. So, of course, there will be dako kayo na siya na issue no if that will happen. So if you already detected that incident at the very first level pa lang, try to correct it right away. So admit na nagkamali ka, inform the CI or inform the chief medtech na alam ma'am nagkamali ko. Kay para dili na siya magawa sa laboratory. It's very difficult to resolve na class once nigawas na siya sa laboratory, nakabalo na si doktor, nakabalo na si nurse, and samot na yun if nakabalo na si patient. So how are you going to explain to patient B na, hala sir, sorry kaayo, dili da ito imuhang result ang HIV positive. So that's really not an excuse. Okay, so you must display this attitude of being honest. Bahala nag makasabaan as long as you already corrected it at the very beginning. Just always remember, class, we are dealing with life. So there is no room for mistakes. But if mistakes will happen, of course, make sure to correct it right away. The next one is compassion. So, of course, our patients who are admitted, dili ni sila ma-admit sa hospital if okay ang ilahang paminaw. So, they already have this discomfort in their body. So, yes, blood extraction is painful, but we must make sure that very gentle kita in performing blood extraction. So, kalimtan ang mga kalagot ng like, ay ex man ni siya sa ako ang kuan, sa ako ang best friend, nag-cheat pa gyud ni siya. So you did not perform, you make the blood extraction painful. So that is not the proper or attitude of a professional. The next one is motivation. So you are motivated to work every day, to arrive sa imong workplace on time. So, that is why, going back to my statement earlier, it's very important, class, to have this passion in your profession for you to serve well, for you to give your 100% in every test that you are performing. So, if maabot ang time that you are not already motivated, sige na lang ka og kalit, daghan na ka og mga mistakes sa imong trabaho, siguro that is already a sign that you need to resign because you are not already effective in your work. Daghan na og affected na mga factors. So, maybe you need to transfer or try another career, you transfer to another hospital, change of environment, so mga inana, no? Then next, we have work ethic. So when you say work ethic class, so you need to follow the standards set by the laboratories. Just like your duty hours is 7 a.m. to 3 p.m. So you need to arrive before 7 a.m. so that you can start at exactly 7 a.m. So yes, let's say you arrive at 7 a.m. but then nag-breakfast pa ka, nanutbrush, nag-makeup pa ka, so, you already wasted minutes or even hours. Nag-start na ka sa imuhang shift at 8 a.m. So, that is, you already wasted time. So, make sure to have this proper work ethic. And all the samples na nag-arrive during sa imuhang shift, make sure to process it. For example, 3 p.m. imong out, and then at 2:30 or 2:45, naa po urine na abot. So, you need to process that sample. So, dili na, ay, next shift na na, oy, kay hapit na mahuman ako ang shift. So, that is not the proper attitude. You need to have this proper work ethic. Okay, the next one is diplomacy. So when you are faced with difficult situation, you are able to handle. So it's really not uncommon in the hospital no na maka-face gyud tag mga incident reports na naatay mga complaints na madawat. So we must know how to handle those types of situation. And the last one is dependability. So you are able to be relied upon, or sa Tagalog pa, maaasahan. So bisag unsa pa na section ang i-assign sa imo sa laboratory, kabalo ka on how to perform the different tests in that section. So, yes, you are dependable. Okay, the next quality of a phlebotomist is public image. So, you need to display this image plus ng positive image. Kaya nga naman, you are considered as the face of the laboratory. You are the representative of the laboratory. Kaya nga naman class, in one shift, for example, 5 medtechs mo ang duty on that shift. So, isa ana mo na siya ang phlebotomist. The rest, ang 4 ka medtechs, they are inside the laboratory assigned for processing the sample. So, ikaw lang yun ang muatubang sa pasyente. So, it's very important to display this positive image. Okay? So, you must be clean, well-groomed, appropriately dressed for the work setting. So, sorry, laboratories, na naman po na sa required ng mga uniforms. So, we just have to follow no with the prescribed na uniform. And then, you must have that good posture. You must be well rested. Lain po nga sige ka og panguyab during blood extraction. So, the patient will not feel comfortable. Na having fresh breath, very important as well, no unpleasant body odor. It's because during blood extraction, close biya ta kay pasyente. So, masimhutan gyud ta ni patient. So, we need to ensure na dili po maka-comment si pasyente on our personal hygiene. Then, clean hair that does not cover the face. Especially for the girls, the hair must be tied back. Ana, kay muduko biya ta during blood extraction. So, ang tendency, the hair will cover the face, not only the face, but also the blood extraction site. And minimal to no facial hair, no facial to tongue piercings, and no visible tattoos. So, we just have to follow the regulations sa HR no sa laboratory or sa hospital kung sa ang ilang requirement on your physical appearance. But for now, nag-modernize naman po ang mga regulations, no? So, wala na discriminations on person with tattoo. So, gina-accept na siya hinay-hinay sa society. Okay, so customer service and communication. So you need to have this to develop your communication skills since ikaw biya ang makipagstorya sa pasyente. So of course, positive communication always start with greetings. Good morning, ma'am. Good morning, sir. I'm Doren, your medtech for today. Okay, so you must let the patient feel that you are approachable. Okay, na kung naa sila'y pangutana nga, ma'am, para asa rin nga test. Dapat kabalo ka unsa ang tubag. You can never answer the patient na hala ma'am wala ba akong kabalo. So it's very important nga even though na human na og eskwela kabalo ta knowledgeable gihapon ta on what are the processes or para asa ni siya na test. Okay, so we have here the communication loop. This communication loop, it's very important for us to send send a message effectively na ma-answer sa ato ang patient. So, of course, si MedTech is the sender in the communication loop because we are the ones who will start the communication process. Okay, mag-start ta na, ma'am, kuha day kog dugo sa imuha today, ang imuhang test kay ingon ani. So, you already sent the message, the information to the receiver, which is our patient. So, once the message is clear, of course, si patient mag-respond nga yes, those are my tests. Gina-allow ta ka na mag-perform og blood extraction. So, nag-send og feedback, nag-acknowledge ni patient ang imong feedback, and after that, you can now proceed with the next step on blood extraction. Okay, so just a reminder, class, on what to remember or to avoid during communication kay pasyente. So, always yun, dili magamit og ng mga highly or very deep na mga medical terms. So, just like, ma'am, mukha og dugo sa imuhang antecubital fossa. Okay, so that is very wrong. Because always lang yun put in your mind, class, na ato ang mga pasyente, wala sila medical background. So, use common terms, layman's terms that is understandable on their level. And then the next one, the next thing to remember is never give false reassurance. When we say false reassurance, like, ma'am, dili ni sakit, ma'am. Okay, that is wrong to say that. Diba? I already mentioned this one on our discussion before. The right thing to say is, ma'am, this is painful, but it's tolerable. Okay? Para ma-prepare po nila ilahang self. So, ako personally, no, masakitan yung gihapon ko every blood extraction. So, how much more sa ilaha na they are not used to these types of procedure. So, we must inform them, we must be honest to them for them to prepare themselves for the procedure. And lastly, avoid calling or addressing your patient in an appropriate term. So the safest way to address your patient is by calling them ma'am and sir. So that is the safest way. Okay? So if ma'am, what if bata ang patient? So ang amo ang ginatawag sa mga bata na pasyente class sa una is ate or kuya. So bahala na gula sila yung manghod. So that is still the safest way to address our patient. Okay. The next one is, okay, so this is nonverbal communication. So kumbaga pa, this is your aura, how you display yourself in front of the patient. Of course, you need to have this good body posture. You need to, first first hour pa lang sa kuano, first hour pa lang sa duty, na gikapoy na ang shoulders kay kana drooping na ang shoulders. And then you need to maintain eye contact kay pasyente because we have patients class who are not really comfortable in blood extraction to the point nga pwede nila ikalipong. So we need to check for signs from time to time if luspad na ba si pasyente, ana, kaya pa ba niya proceed with the procedure. And then, of course, well-groomed appearance. We need to ensure na ato ang lab gowns dili siya kumpot, ano, and respect of personal space. So this is for our patients ng mga admitted. So before ta mosulod sa room, manuktok sa agyod. Manuktok, ma, magkuha ko og dugo, Yun, ana. So, if the patient will say no, kay nagailis pa, proceed na lang sa next patient. Balikan lang nato ang kanang current nato na pasyente. And atong wala na discuss is the bedside manner. So, bedside manner. When we say bedside manner class, so admitted gihapon ni siya ng mga pasyente. Pag mag-extract tatapad kay patient, after blood extraction, we must check if naa ba tayo nabilin. Nabilin ba ang gloves? Nabilin ba ang needle? Unsa ba na? So we must always check the surroundings if naa tayo nabilin nga mga any equipment. Because we have this experience before, no? Na si Medtech, nabilin niya ang lancet tapad kay baby na naasulod sa incubator. So maayo na lang nakita dayon ni nurse, wala pa nag-roll si baby, wala pa niya na-touch ang lancet. So that action is very, very dangerous and risky. So always good, check. Check. Pila lang man naka-seconds ang matake sa imuhang time. Check if na ay nabili. Okay, the next one class are the different types of patient consent. Okay, so it's very important to have or to get the consent of the patient before blood extraction. Okay, because it involves manggod the needle, insertion on the vein, of course, pain on the patient. Okay, so we need to get their permission before we can start with the blood extraction. So it should be informed. So voluntary permission. When we say voluntary, si patient mismo nagbayad sa cashier, kana na siya request, pag itawag nimo iyang pangalan voluntarily, ni adto siya sa phlebotomy area, nilingkod sa phlebotomy chair. So, voluntary permission. So, we have these two different types of consent. It can be expressed or implied. When we say express class, so, naay verbally, giingon niya, or in writing na, yes, I'm allowing you to perform blood extraction. And when we say implied, so, no words given but nagnad si pasyente, kato niglingkod siya sa phlebotomy chair, gi-extend niya iyang arm for you to start with the blood extraction process. So that is implied. Okay. The next one is HIV. So for patients class na ay HIV test, dili lang ni pareha sa CBC na diretso lang with the blood extraction. So they need to undergo counseling first before the actual blood extraction. So in the counseling, so naadihay naka-specify sa law ug unsa na mga information ang ihatag ni pasyente sa imuha. So example of the information, pila na ba imong sexual partner? Unsa ka na edad nag-start sa imong sexual activity? Like that. Na what is this test all about? Pag nag-positive ka, asa ka mo adto? Pag nag-positive ka, unsa ang next step? Okay, so after that, if nag-agree si pasyente with the procedure, so kailangan siya mag-sign of consent. Okay? And for the releasing of result naman class for HIV, so it's very confidential man condition na test. That is why the only person allowed to get the result other than the patient is the doctor who requested the test. Okay? So, ma'am, what if ako ang mother, gitagaan ako og authorization letter to get my result? So, dili gihapon na siya allowed. So, it must be the patient ang mukuha sa result. Okay? So, for minors, so makita man nato ang age ni patient, no, on the request form. So, if wala siya kauban, we need to ask asa ang iyahang guardian before we start with the blood extraction process. And then, the next one is refusal. So, this is a usually na case for our patients who are hospitalized for a long period of time. 1 month na hospital, unya, almost every day na blood extraction, din nakapoy na si pasyente. So, we cannot force these patients, no, to proceed with blood extraction. So, always remember, an individual has a constitutional right to refuse a medical procedure. Di na to pwede pugson si pasyente. Okay? So, ma'am, what will be the next step if ever si pasyente wala yun siya nisugot? Okay, so we will get a refusal form. We must have 3 copies of refusal form. One for the patient, one for the laboratory, and one for the nurse station. Okay? Kaya para if ever manawag si doktor nga nag-request sa test na, ma'am, gahapon pa man ako nag-request. Wala lagi gahapon yung result until now. So, we can inform the doctor na, Dok, nag-refuse man gud na si pasyente. Or better, upon refusal ni pasyente, nag-sign na siya sa refusal form, call the doctor immediately na, Dok, nag-refuse si patient for this test. So, that's the time where si doctor na gyud na ang mag-convince sa ato ang patient. Okay. Okay, so legal issues. What are the legal issues na pwede na to ma-face no in the laboratory? Okay, we have 4. So the first one is confidentiality. Okay, so in the laboratories class, we have so much information no, about the patient. So just by entering the name of the patient, mag-reflect na dayon diha ang iyang edad, iyang birthday, cellphone number, address, unsa ba iyang mga test, ang mga results niya sa previous test, and the rest. Okay, so we must not use that information for our personal interest. Nang blackmail ka, nga, uy, kabalo ko nga HIV positive ka, taga ikog kwarta, kay spread na ko ang news, ingon ana no. So, pwede ka makasuhan because of that act. And, example, ginagwapuhan jud ka sa imong gikuhaan og dugo. So, you check the information, giadtuan nimo sa balay, nakuyawan na si patient na niabot na sa medtech sa ilahang balay. So, that is a no-no. So, do not ever use those information for personal purposes. The next one is battery. So, you have this harmful act na gipugos gid mo si pasyente, gibirayod ang kamot for blood extraction, and then nagkapasa si pasyente. So, pwede jud ka kasuhan. Another one, offensive touching. Okay, you touch the patient in other parts of the body. So, only touch the patient kung asa lang gyud ka na area mo kuha og dugo. Okay, pwede gihapon ka og kasuhan because of that act. Next one is negligence. So, katong gi-mention ako kaganiha, katong na baliktad ang label, katong nakabilin og lancet tapad sa baby. So, pwede ka kasuhan because of that. And malpractice. Okay, you use your profession for a different purpose. Nangontak ka og mga drug addict, ikaw nag-infuse sa ilaha or ng mga injectable na drugs. Okay, and we have this another case before, katong COVID-19, na naay mga medtechs who participated in illegal works na nagkuha sila og dugo or nagkandak sila og testing no sa mga patients who want to be tested for COVID-19. So, for a lesser na price, kay nag-work man sila under the table, then dili pa gyud approve ang ilang kits na ginagamit. So, gikasuhan sila na revoke ang ilang license. So, we must always think lang gyud class na in every act na to ang himuon, go back to your sacrifices and struggles when you are still trying to get that license. Okay? Kung unsa nimo gikamang ang imong pag-eskwela, pag-review sa board exam for you to be a licensed medical technologist. Okay, para masugpon ng RMT sa imong pangalan. So always think of that before participating in this kanang mga negative na actions. Okay, so that's it for the part 2 of understanding phlebotomy. I hope that you learned something, and thank you for watching up to this point sa discussion. So, I hope that all of you are safe today. So, that's it. Thank you everyone, and God bless you all.